Dear viewers, welcome to my channel, the medical channel and outpatient clinic. New episode, very important topic about erectile dysfunction. Again, this channel and these episodes are meant for educational and informational purposes only. So take whatever I said as no treatment over the internet or YouTube. Rather, you should consult with your family physician. This topic is extremely important and not talked about a lot. And a lot of men tend to be shy and not even bring the matter to their family physician. Therefore, I'm bringing the most recent up-to-dates and treatment of erectile dysfunction. First of all, definition of erectile dysfunction means persistent inability to maintain or achieve erection sufficient enough for intercourse. Now, decreased libido is another problem, decreased sexual desire, but does not necessarily mean erectile dysfunction. The incidence of ED, it occurs 40% of men above 40 have some sort of ED. It could be mild or moderate or severe. 50% of men above 50 years old, 60% of men above 60-year-old, 70% of men above 70-year-old has some form of erectile dysfunction, while 80 or 90% of men above 80-year-old have ED. The causes of ED could be psychogenic, such as performance and anxiety, stress, depression, or anatomic, such as Peyronie's disease from plaques, fibrous tissue occurring, or some sort of accident or a bike accident can happen. Or it could be most directly related to diabetes from endocrine causes, or hypogonadism, decreased testosterone, or hyperprolactinemia, increased prolactin level in the body for a tumor or some gland that perform this prolactin, which could be related to the hypothalamus or pituitary gland, or hypothyroidism, which is related to the thyroid gland. Could be vascular from atherosclerosis or venous leakage. Could be neurological, again from diabetes or a CVA, a stroke, or a spinal cord injuries from a car accident or whatnot, or a disease called multiple sclerosis or autonomic neuropathy, which could happen in diabetes as well. Surgical treatment such as prostatectomy can cause erectile dysfunction because it's a radical prostatectomy can damage the nerves. However, there is a type of surgery called nerve-sparing prostatectomy, which may cause less in the ED. Some alcohol and drugs can cause that, as well as medical causes such as heart failure, coronary heart disease, liver cirrhosis from alcohol, or severe obesity or obstructive sleep apnea can happen and cause ED, or some medication. Famous medication are hydrochlorothiazide used for blood pressure control, propranolol used for people with liver disease and hypertension, as well as some antidepressant and sedative medication can cause ED. Another medication called cimetidine, but we're not using it much nowadays. How to diagnose? We diagnose by the history, how long the problem lasted, whether or not you have a nocturnal erection. If you do, that kind of tends to point about psychological causes, not biological causes or organic causes. The age at onset, whether or not you take smoking, alcohol ingestion, and whether or not you have loss of libido. You do, your doctor will do physical exam for the abdominal area, the genital exam, the testicles, signs of peripheral vascular disease, peripheral neuropathy, or enlarged breast in a man can point to gynecomastia, which is a disease necessarily causing increased prolactin level and cause erectile dysfunction. We do tend to send patients to do blood tests such as CAM12, the complete liver function test, kidney function test, a complete blood picture, hemoglobin A1C for diabetes, TSH for thyroid. We do test the testosterone level, whether free and total. We do test estrogen level in men. Believe it or not, you do have some estrogen, but if it's more than appropriate, it can cause ED. We do tests called dihydroepiandrosterone, sex-hormone binding globulin, and luteinizing hormone. This is a very important test, penile Doppler ultrasound with trimix injection. We inject the penile tissue with trimix. It's a material, is a a medication or injection has three components: papaverine, phentolamine, as well as prostaglandin, PGE1. This causes artificial erection in the clinic, and we do tend to do ultrasound, penile duplex ultrasound. We check the corpus cavernosa and see that spongy area, whether or not it's homogeneous and intact. We do check the arterial pressure of the penile artery and the venous pressure to diagnose whether or not you have venous leakage. We do measure the systolic and diastolic flow and pressure. We do measure the homogeneity of corpus cavernosum. There was a long time ago a test called corpus cavernosography. We don't tend to do it anymore. The treatment, psychological treatment by referral psychologist, psychiatrist in people with psychological causes. We did discontinue medication that cause ED, which I presented before. We ask stop smoking and drinking. We do treat with medication a group family called phosphodiesterase inhibitors, such as Viagra, Cialis, Levitra. Viagra is taken 25 milligram 1 hour before intercourse, or 50 milligram or 100 milligram. Note Viagra has side effects of headache, can cause blurry of vision or nausea or vomiting. Tends to get better with use. Your doctor will start 25 and go up to 50 or 100. Should not treat yourself or get online medication without talking to your doctor. Viagra used to be $33 a tablet. Now it's almost $1 or $2 for generic Viagra. A lot of sites for online, but again, I don't advise buying medication on the online without getting appropriate advice from your doctor. Cialis is taken as 5 or 10 or 20 milligram 1 hour before intercourse. Cialis could be beneficial as it can last the effect up to 36 hours, or Viagra usually 8 to 12 hours. Cialis can be given 5 milligram daily, which enhances the prostate as well, and it kind of helps penile tissue. Levitra is taken 20 milligram prior to intercourse. Again, this medication would treat the symptom but would not diagnose why you do have ED in the beginning. For that reason, I would like you to see a urologist or a specialist in sexual medicine, do the appropriate testing, appropriate history, appropriate exam, and penile duplex ultrasound prior to taking Viagra and getting yourself Band-Aid or treatment that will not last. Note that Viagra after a few years might not work, especially in people with uncontrolled diabetes and people with venous leakage. Viagra will not work. There is trimix injection. Like I said, there is a 3 medication: prostaglandin, papaverine, phentolamine. This is the injection is given to you with the supervision of your doctor. He'll show you how to give it. You should give it straight to the side of penile tissue, and not on top, not on the bottom. And this is really needs supervision the first time in his clinic to show you how to do it. A lot of people don't like it, which is painful. It do work better than Viagra, but it has side effect priapism, which in continuous erection lasting persistent more than 6 or 12 hours. This is really dangerous and need to go to the ER right away for the doctor in the emergency room or the surgical theater to operating room to remove the blood. Otherwise, you can damage the penile tissue. Another modality of treatment is vacuum erection device, which I'll show in a minute. It treats people with venous leakage. Note, for erection, you need arterial sufficiency. You need the systolic pressure. You need good flow of the blood to the penile artery, a lot of flow. The flow is prohibited or diminished because of diabetes, damage endothelial wall, hyperlipidemia, smoking, obesity, all of these factors, particularly diabetes, it damage. So you do not get enough flow, so you have ED. Viagra and Cialis could help that a little bit, but also in diabetes, you have the outflow, the backflow, the venous leakage. The whole idea is to keep the blood in the penile tissue and keep it constricted, keep it with a good cavernous cavernosa, which relax, push on all the veins, and prevent the blood to leave the penile tissue or leave the penis. Now, because you have diabetes, you damage the veins as well, and you damage the corpus cavernosa, so you don't have any protection. You don't have any way to keep the blood in. You do have venous leakage. The blood going in is too little. the blood going out is too much. That's why you do have erectile dysfunction. Think of it like a tire, a discount tire, and that tire was full of air, but you have so many nails that cause a lot of holes, so you lost the air. Think of it as a balloon full of water, and all of a sudden you put some needles and you puncture some holes in that balloon. Certainly you're going to lose the water and you're going to deflate. That's the whole idea of erectile dysfunction. For that reason, you need appropriate diagnosis and appropriate treatment. One of you would say it's harder to treat any disease. I say it's harder to diagnose any disease. That's why you need an expert to diagnose first, see what's the problem, and then appropriate treatment could help you and help save your marriage. Do not look at a lot of porn movies and compare yourself to those actors. In my opinion, this is just a fake movies. And also, do not look on the internet and buy anything over the counter or buy anything herbal medicine or buy anything that enhances potency. Rather, go to your doctor and get treatment. Vacuum erection device is a good device. Do artificial suction of blood into the penile tissue, and you have an erection ring which is made of rubber, and it kind of slides in and prevent the blood from leaving. It's a very good modality for treatment of bad diabetes with bad erectile dysfunction with also bad venous leakage. However, it just causes pain, and you should never leave the ring more than 30 minutes. Otherwise, it can damage penile tissue because you're constricting and do not cause any blood flow. Again, remember, trimix injection will cause pain and can cause some hematoma, ecchymosis. It tends to go away, but the major risk if you do priapism, if the medicine is too strong, cause the blood to be there and cause the erection for more than 6 hours, even 8 or 12 hours, that's very risky. A medicine called Yohimbine can do help that, but we don't tend to use it a whole lot. It's not even in the any pharmacy now in the U.S., usually given online. This medicine can cause tachycardia, palpitation. I don't advise you buy it. One big modality is testosterone. We definitely need to have a good levels of testosterone. The caveat, you need to take the appropriate amount of testosterone. It's given through testo gel you put on your shoulder every day, or given as a testosterone injection, intramuscular injection in the shoulder or the buttocks once a week. You do tend to measure the testosterone level and a bunch of tests and determine what's the appropriate dosing, as well as testopel. Testopellet or pel are 6 or 12 pellet they done in the office, implanted into the buttocks and give you enough testosterone for 6 months. It gives slow release of testosterone. However, just not physiological. It kind of tends to get up too fast, but then goes down too fast as well, and is not consistent levels in the blood. Any of these would help bring your testosterone levels high. Note, too much testosterone can cause acne, can cause cancer, can damage the liver, can cause heart attack or a clots in the lungs or a stroke. I'm talking about too much testosterone levels. Also, it can enhance prostate cancer. People that have tendency to have cancer, you keep giving testosterone too much, it can enhance their cancer. For that reason, you need to follow your urologist or sexual medicine specialist. You need to follow the levels. You need to follow the PSA, prostate-specific antigen. New modalities in the USA, Shockwave therapy with a new machine called Urogold 100. It's an excellent machine. This Shockwave given under pressure 13, 14, 15. We tend to give about anywhere from 3,000 shocks to all the way to 4,800 each side of the shaft, and we do give the perineal region. These shocks, Shockwave under certain pressure, tends to create a way for angiogenesis, meaning the penile tissue will start making blood vessels, and it's like a trees and branches of vessels and vessels and vessels. The more vessels you have, the more blood flowing, the better it gets. So this is a good modality. We use the Shockwave every 2 weeks, I think for 3 times. Some protocol give it for 6 Shockwave therapies, and then you wait a month and a half or 3 months and you do duplex ultrasound of the penile tissue and check the results. There used to be a stem cell injection, but that kind of went out of favor. It didn't prove potency. The big one is moving its way is plasma-rich protein. We take your blood, centrifuge it, discard the red cells, take the plasma full of proteins, inject the same plasma back into the penile tissue under lidocaine injection. It's painful, but with lidocaine is okay. We tend to hope that this plasma-rich protein from your own body will create healthy protein, will repair the damage in the corpus cavernosa and help prevent the venous leakage. There is an injection called Vylessi injection, which is new. I believe it's getting itself FDA approved. Some insurance companies start providing it. It's excellent treatment. It helps ED. It helps increase the sexual pleasure and ejaculation and orgasm for men and women. It's amazing for women. It acts on the central nervous system in the brain, affects the chemicals in the brain of the woman, and works its way. Excellent treatment for women with low sexual desire, with less of libido, and it enhances the pleasure and the orgasm. And it can even give women multiple orgasms. So it's really a good treatment, and it's really a new modality, and it's pushing its way. You can read about it on the internet. I believe it's expensive. It could be up to $100 injection, but some insurance offer it at one injection per week for $25. You should not take more than 2 injections every week. Exosomes injection is under investigation. Some centers in Los Angeles given that. It's very expensive treatment. They take the exosomes, some proteins, and inject it in the penile tissue. And some doctors start giving Botox injection in the penile tissue as well. The idea, like Botox, plastic surgeon give it to relax these muscles and remove any skin damage, and so you look younger. The same way you tend to relax the corpus cavernosa. It's given every 3 months, and tend to hope that relaxation will cause constriction on the venous leakage and prevent venous leakage. So you tend to keep the blood more in the penile tissue. At that level, you could achieve good erection. Surgical treatment, last modality, we have penile implant. The most usable in the United States, inflatable implant. It's really mimic and close to natural way of having erection. You destroy the corpus cavernosa, you implant 2 tubes, and you fill with saline, like I will show you. The old system, semi-rigid implant, you do not feel anything, but I don't advise this one a whole lot. It's not very physiological. Premature ejaculation is ejaculation occurring in less than 1 or 2 minutes. The treatment is training exercises, some medication, some psychotherapy, and some medication, SSRI group of antidepressants such as tamoxifen, tamoxetard, and medication called Wellbutrin. It can help. Venous leakage can cause and worsen ED, and some treatment would be the erection device or the plasma-rich protein, including the shockwave therapy. It may help. Diabetes mellitus usually has 2 problems: vascular insufficiency, atherosclerosis, damaged arteries, as well as damaged veins, as well as damaged corpus cavernosa. So you tend to have venous leakage and arterial insufficiency. You kind of treat that with vacuum erection device or surgical treatment. Frigidism in women, dyspareunia, meaning pain with sex, can be treated with estrogen topically. Your doctor can write that, and you insert it through inside the vaginal wall, and it kind of works, and it helps decrease the pain, especially in postmenopausal women. Again, Vylessi is pushing its way. It's excellent injection. It helps a lot with women postmenopausal. This is just slides of a man frustrated. Here, another urologist telling us to stop smoking, treat obesity, treat the low testosterone level, stop alcohol, stop depression, work on relationship issues, and stop the sleep apnea. This is a photo of Viagra. This is again the arteries as they progress in age and diabetes. So here's normal healthy artery, normal healthy wall. Here, the yellow part are atherosclerosis, cholesterol plaques. You can see you kind of caused already right here a lot of cholesterol, a lot of plaques, and you make the artery very narrow. You cause blockage, you cause insufficiency, you cause not enough blood flow. Here is a good cross section. This is the corpus cavernosa on the right and the left side. This is the main culprit. This is the main way to compress on the veins and keep the blood in. If you have damage here, the blood simply will go away, will go back to your body. That's why you don't have a good erection. If you have to give trimix injection, you have to kind of give it here at the 3 o'clock or 9 o'clock. You should never give it at 12 o'clock or 6 o'clock. You should never give it on top or bottom. Here you can damage the urethra, and here you can damage the arteries. You can cause bleeding, and you can cause a lot of problems. I do not advise a whole lot of trimix injection, but some men still like it, get good erection. Again, watch for priapism. It can cause pain, and it can cause some fibrous tissue down the road and worsen your ED. This slide again shows the dorsal vein is here, the urethra is here, the glans penis is here, the nerves are here. You need good veins, good arteries, and good nerves. This is the corpus cavernosa again, cross section. This is the superficial dorsal vein, and this is the urethra here. And this is the corpus cavernosa. It has to be homogeneous, it has to be strong, it has to be healthy for the erection to happen. This is again cross section, show you where is the dorsal artery, dorsal vein. And note that we do tend to do duplex ultrasound. We measure the pressure of the blood going in, and we measure the pressure of the blood presumably going out. Normal pressure should be 30/0 or 35/2. You should not have diastolic pressure or pressure of the blood leaving the penis more than 0 or 2. If you have venous leakage, the bottom number will be 12, 13, 15, or even 18. If you have a good arterial system, no diabetes, your blood going in should be 30 or 40 or even 50. So that kind of tells us, clue what's going on with the blood going in and going out. This is a good duplex ultrasound. This part is the corpus cavernosa. This is the sponge way that is very healthy, very homogeneous. No holes at all. Imagine of a brand new sponge, you bought it from Home Depot, it's healthy, you just got it from the shelf, it looks very good, it has no cracks, you soak it with water, it keeps the water in, it looks healthy, it's very good. This is the same idea. It's a kind of sponge that got created, and it should keep the blood in. This is a bad corpus cavernosa. You see a lot of holes in black, sort of like Swiss cheese pattern. It's not homogeneous anymore, a lot of holes. So this is not healthy. This is not keeping the blood in. Similar like a tire full of holes. This is a picture of how we measure the inflow, arterial flow with the penile ultrasound. This is again Swiss cheese appearance, a bad corpus cavernosa from diabetes, untreated, and cause a lot of holes. All this black look like a Swiss cheese, a piece of corpus cavernosa full of holes, cannot keep the blood in. This part is more healthy. This part is not very healthy. This is the worst. This is the good part. So you need to be careful about all of this. This is again a way to give the trimix injection through the side way, not on top, not the bottom. This is the vacuum erection device. It can come manual or with battery. And post-vac is a good device. And you can kind of use different rings. The whole idea is to create artificial erection and keep the ring at the bottom to prevent venous leakage. Should not keep this ring more than 30 minutes at all. Otherwise, you could damage the penile tissue. This is the penile implant. This is inflatable. You kind of destroy the corpus cavernosum, your surgeon, and implant these. And this is full reservoir full of saline. You kind of push, inflate, fill it with saline, kind of cause artificial erection. This is the last resort. And know that this is a one-way ticket. You cannot bring back the corpus cavernosa and say, wait a minute, I want it out. It cannot be out. Can cause infection, it kind of lasts 10 years. You may need to repeat it. And in diabetic or people with bad diabetes, it may cause some infection, needs antibiotic. Sometimes I've seen patients have to remove the whole implanted device or implant and put a new one after 6 or 12 weeks. This is the semi-rigid. We don't tend to use it a whole lot. And this is the inflatable one. We tend to be more physiological and more close to natural. With that all, this is the causes of ED, and this is the treatment of ED. My best wishes for you, my advice: treat your diabetes, treat your diabetes, treat your diabetes. Take care of your health, lose weight, eat healthy, take good control of your health issues, see your doctor early, do your homework, do your duplex ultrasound, diagnose what's wrong. New modalities: shockwave therapy is good modality, plasma-rich protein is excellent modality, Vylessi is another medication pushing its way, Botox is under protocol investigation. With that all, good luck to all of you. But my advice: don't just buy over the counter, over the internet. Don't treat yourself with Viagra day and night, but rather see your doctors and do appropriate investigation, appropriate treatment. Thank you very much. I hope you like this important topic. You learned something new. I would be more than happy to answer any questions. Leave your comments. Please subscribe to my channel and push the subscribe button and push the like button so my video will be shared with a lot of people. Thank you very much. I see you with the next video with Outpatient Clinic. Thank you.